Every morning across Florida, millions of children wake up ready for school, ready for a new day. Families do their best to give them safety and love while hoping that their child's health is protected. But for many families, there's a question looming behind that hope.
Florida KidCare is one of the state's insurance safety nets for children. For families that earn too much to qualify for Medicaid, but can't access or can't afford private coverage on their own. It covers doctor's visits, immunizations, dental, vision, and more. The legislature passed a law to expand KidCare, raising the income eligibility limit from 200% to 300% of the federal poverty level, meaning many more families would finally qualify for subsidized coverage.
Thank you, Mr. Speaker. You know, we're going to be in this chamber a long time, and we're all going to debate different issues, but I can, without a doubt, tell the people in Florida that this chamber, Republican or Democrat, cares about their working families, and they're going to help them, and they're going to help their children, they're going to keep their children healthy, and they're going to ensure that they have economic prosperity. This bill is 3 years in the making, and our speaker started this session by saying that no family should have to choose between a raise or health care for their children. This is here today because of our speaker, because of this bipartisan effort. So when you open the papers tomorrow, I hope we are focusing on this bill, which is going to help over 77,000 families just this year, hundreds of thousands of families throughout time, and it's going to keep our most precious asset, Florida's children, healthy. Thank you all so much.
Show the bill passes.
For a family of four, that's an increase from roughly $64,000 to $95,000 a year. The expansion was supposed to take effect January 1st, 2024, a promise of broader access, greater stability, and fewer uninsured kids across our state. But the expansion never happened. When Florida submitted its request to the federal government to implement the change, it objected to a new federal requirement. Children receiving subsidized coverage must receive 12 months of continuous eligibility, even if their parents miss a premium payment. Florida has refused to comply with this federal requirement since it went into effect, instead continuing its practice of disenrolling children for non-payment. The state went as far as filing 2 lawsuits against the federal government to try and make the requirement go away, but it's still in effect. And meanwhile, even though the federal government has approved the KidCare expansion, Florida has refused to move forward with implementing the expanded eligibility.
On February 4th, Florida's Medicaid secretary took questions about the holdup from a House committee.
And we're tired of seeing bills from past 2 years down the road. You know, we high five when we pass it, but the families, they're not high fiving. They're clenching their hands together, praying that it gets down to their level. So the question is, do you need anything from us, and what is it specifically we can help for you to implement this?
In order to implement the bill as passed, in my opinion, I don't believe further. You guys passed the bill. I believe we need to let the litigation play out against the federal government to see what becomes of that interpretation.
The consequences aren't abstract, they're real, and they're growing. Florida ranks 46 out of 51 states and territories in the percentage of uninsured children. And the expansion that would provide more stability and lower costs for families remains frozen. Behind every statistic is a child, a family living in limbo. Naomi is one of many parents doing everything she can to support her child with serious developmental needs.
My son has been diagnosed with autism at the age of 16 months. As of today, he does not have any insurance because we were deemed that we made too much in order for him to receive assistance. And so pretty much as of today, my son has no insurance, and it's really, really hard, and which is causing me to really be in a financial crunch.
For families like Naomi's, KidCare isn't optional. It's essential. Therapy, early intervention, stability, hope. Aaron's son Landon is a cancer survivor. He still needs regular checkups, monitoring, and ongoing therapy. After Florida's Medicaid redetermination, Landon was dropped.
It's so hard to function and afford all of this. We have KidCare and it's pricey, but also there's a lot of issues with them not covering his OT, PT, and speech therapies. Landon needs to be on CMS KidCare, which is only offered for subsidized people that can get subsidized KidCare, and we don't qualify for that. And so my son is not being given the care he deserves because I make too much money. Now I have to pick and choose. I have to pick and choose of what to pay for, or he doesn't have a house, or he doesn't have health care.
Families like Aaron's are stuck between full-pay KidCare, which doesn't meet complex medical needs, or no coverage at all. This isn't about paperwork or budgets. It's about children's lives. For many Florida families, KidCare means preventive care, life-saving medicine, essential therapies, early intervention, stability. But with the expansion stalled, families earning too much for Medicaid, but too little to be able to afford full-price premiums fall through the cracks. Delaying the expansion doesn't just pause a program, it denies children the care their lawmakers promised them, the care they need to thrive. Florida made a promise to expand KidCare, a promise that would help tens of thousands of children. The law passed, families prepared, but the promise remained stalled, and these children still don't have access to this important coverage. You can help move this forward. If your child has been affected by the KidCare delay, contact the leaders who have the power to make change. Tell them your story. Explain how the delay has impacted your family, your child's health, your financial stability, your peace of mind. Then urge them to act. Tell them it's time to demand that the Agency for Healthcare Administration immediately implement this critical legislation as required by law, because every day of delay harms Florida families. Florida's children can't wait. Families can't wait. A promise was made, and it's time to keep it.